So Wei-Hsi Pang, the site lead for the Queens Bowmanville Oshawa Lakeridge program, and that is quite a mouthful, so I've shortened that. We shortened it down. We affectionately refer to it as QBOL. There's a little red dot there. I know it's information overload today, so just look for color in the slides. We're not testing on anything, but if you remember a few things that are in color here, that's probably all you need. If anyone's good at logo design, you could obviously use a little bit of help there. So a little overview. This basically will tell you who we are, what we're trying to do curriculum-wise, and then at that point, if you're still interested, we'll show you where we are, how to find us, and what we like to do there. Okay? Questions, again, will be at the very end with all the segments in the program there. So QBOL, there's the color again. So Queens, Department of Family Medicine, Bowmanville, Oshawa are the two sites in Durham region that are home to most of the community preceptors that are going to be teaching it. And Lakeridge Health is the name of the hospital network that covers all of Durham region. 2012, this July is going to be our first batch of residents, so we're pretty excited there. But you can rest assured that we do have many preceptors that are quite experienced in taking residents, so you won't be brand new, you know, the kind of level of training, level of supervision that you require. That's specialty and community preceptors there. And again, it's been referred to before, so I won't belabor the point, but you have that quality assurance that we are part of Queen's Family Medicine program. The two sites, Belleville and Pedro, that have been manufactured in this kind of new CCC, horizontal integrated curriculum fashion. We're highly regarded in accreditation there, so we're just kind of following along. We're taking a picture of the admin offices, but that's where the site lead and the site coordinator's offices are. This is the Lakeridge Health and Education Research Network, another acronym that's not in color, don't worry about it. And it's housed in the main site, the Lakeridge Health Oshawa site. There is a 200-seat auditorium, quite nice, 3 big screens that are all controlled from the podium, I guess if you can trust the technology. And there's also conference rooms, small, medium, large. The bottom picture there on the right is a library. You don't see many shelves there, but it's actually all online materials. It's workstations all along the side there. There's a little shelf on the right side there for recent periodicals. And off to the left, there's a set of 4 little study rooms, so just like the university libraries, little room with just a little desk and a door, and you can have some quiet time. This library is 24-hour access on your ID badge, so if you need to go after hours, it's there. You can use the computers for internet and such. 2 sim labs that was alluded to earlier as well, so brand new, all new equipment, and we're definitely going to be utilizing that in our training. Bottom 2 pictures there are pictures of our resident lounge, which is actually in the Oshawa site as well, the Learn Center. So the picture, the little microwave and fridge, and then a little desk and couch and some workstations. I didn't take a picture of the TV because I'm not officially allowed to tell you, but there's a TV with cable in the hospital. Staff doesn't even get that. This is a picture of one of my exam rooms in my clinic. So we have extra funds and resources. We're going to be making sure all the family medicine offices are resident friendly. So things like a separate desk and computer for you, all on EMR of course. Video recording equipment for at least one of the rooms, tax trainers, that kind of thing. And again, one of the newer sites, so we're following this kind of CCC horizontal curriculum with a long-term relationship with the community family medicine preceptor in their practice. And the kind of side experiences built into that. So basically you're going to be learning something with a specialist or in a different setting in the hospital, and then always bring that knowledge back to your family medicine setting. Majority of the clinical teaching is going to be done on site, so again, we're trying to minimize the use of technology, video conferencing, that kind of thing. We have enough preceptors that we can host most of our academic days ourselves. Trying to minimize that travel time, especially we're that much further away from Kingston, and we don't want residents to have to be going back and forth more than we have to. Okay, a bit more color here. So one thing I would like you to remember about our program is our first month of PGY1, which is the toolbox. And that's some time that you're going to get started with your family medicine preceptor. So you'll get to know their practice, get to know them a little bit, figure out their EMR, that kind of thing. But instead of having those kind of specialty experiences on the side, we're actually going to do some orientation, so community orientation. I think we're doing something like a scavenger hunt or an amazing race thing. So if you can't afford birth control, you need to get some, where would you go? If you found out you had hepatitis C, where would you go? So we kind of let you actually go and physically see those various spots in our area. On top of that, also community integration, so we're hoping to kind of get to know what makes you tick, interests, hobbies, that kind of thing. And then we'll try to get you set up early on so that you can feel comfortable and kind of carry on with things that you need for self-care. On top of that, you'll get the basic kind of instruction using the Sim Lab, the alarm course, the Nightmares FM course that was mentioned, the ACLS, CAS technician, that kind of thing. So we're going to give you those tools right off the bat so that when you do come across things later on in your training that you'll be able to get more out of it. You'll have already gone through it once or twice in a simulation environment, so you should be able to just kind of jump in there. And then after that, you'll be into this family medicine integrated curriculum there. So about half the time you're going to be in with your family medicine practice. We're going to have like a 2-to-1 ratio of supervisor to resident. So in case your primary family medicine supervisor is away, then you don't have to change clinics or change EMRs or anything like that. We've decided to go with 2 academic full days per block. The block is 4 weeks, so instead of every week having to come out of rotation or away from experience or not being able to be on call the night before, it's only 2 times per block. We know that's going to be a little bit long, so it's not going to be all one style of teaching. There'll be lectures, there'll be hands-on stuff. We would think about using that kind of full day to an advantage and maybe doing like a little field trip. One idea was First Nations reserve, because we don't have access to that in our area, so we'll be able to take residents and actually put them there on site. Won't go too much into the horizontal experience, so basically you get the idea that they're all built in. But we'll put a little mention for the one point at the bottom there. Behavioral medicine, pediatrics, procedural skills, lumps and bumps, and palliative care, we're setting things up to be referred to yourself. So if you have a patient in your family practice that needs to see a psychiatrist, you would refer to this particular psychiatrist and you would be actually working with that psychiatrist again, see your same patient at that point. So you already have that relationship and they're not going to say, I want to see you, that kind of thing. And then on top of that, you'll assess, come up with a plan. And then when you go back to your regular office, you'll be able to follow through on that plan, follow up more than you would with just if it had just been a specialist notes. A lot of color on this one. This basically is kind of following along all 8 of our residents through their 2 years. So basically you just have to pick one of those lettered lines and go across. The idea is just to show you a little bit of a breakdown. You can see the first month and first year, top left is green. And that's that toolbox month, so everyone's starting out in the same place. After that, there's a lot of blue, and that's the family medicine time with the extra experiences built in around that. There's a few little blocks there, so the brown is inpatient care. We left that as a separate block, just seems to work best that way. And there's 2 blocks of elective, in the first and second year, 1 each, roughly. And then there's a block of rural in the second year there. Then I'll just point out the little ribbon along the bottom there. So the first part, top left, the bottom is purple. That's obstetrics. So obstetrics, we're going to try to concentrate early on in your first year. And again, it's still going to be in that horizontal fashion, so you get like 3 obstetrical shifts per month, per block in that time. And we're going to, again, try to kind of schedule you with 1 of 2 preceptors so you'll have that continuity of supervision. And so the preceptor will know where you left off and what you might need extra work on, that kind of thing, from time to time. After the midway through your first year, if you do have an interest in obstetrics, you definitely can continue to build on your skills and kind of maintain them through the rest of your training. We definitely are encouraging that, and that would just be by picking up an extra shift of OB somewhere, like on a weekend or something, over time. But those 3 shifts per block are going to be switched over midway through your first year to the red. Red is emerge. So after you've had 6 months in, you should have a pretty good base. Then we'll put you into the emerge. So we're trying not to put you in over your head. And another way we're doing that is we're going to start you off with our Bowmanville site. Bowmanville is a smaller community family hospital, family doctor-run hospital, and there's an emerge there that's family doctor-run. So you'll start there, build up your skills, and then somewhere in the second year when you're ready, we'll move you over to the Oshawa emerge. And the Oshawa emerge, high volume, high acuity, kind of go. So we'll try to kind of match your experience to where you are in your training. Okay, and this slide I think we've gone over a lot. Merge will be, the one thing I would like to mention is between PGY1 and PGY2, so first and second year we are going to encourage you to switch preceptors. We think that 1 year is a good amount of continuity for one practice, then because we have those 2 communities, we can switch you from Oshawa to Bowmanville or vice versa. And that'll give you chance to practice in a different setting, in a different specialist backup, different approach. Even if you don't want to, or aren't able to switch communities, I think there's still some value to switching preceptors even within a site so that you can get a different approach or that kind of thing. Okay, so if you're still interested, I've got my version of the map too. So this is Lake Ontario here, and QBOL would land right around there. It is actually a fair size area, so it is Durham region. We don't quite infringe on the US border there, but otherwise we take up a lot of space east of Toronto. It's about 40 minutes highway time from Toronto on the 401 on a good day, and about an hour to Peterborough, a bit over an hour to Belleville, and 2 hours to Kingston there. So this picture of the Oshawa Clinic on the left, that's my home clinic there. It's one of the birthplaces of group medicine family practice in Canada. It's over 80 years history. That's one of our 3.5 buildings. There's a 4th building going up right now. About 110 doctors, half and half specialists and family doctors. On the right is a picture of the cancer center, part of the Lakeridge Health Oshawa site. Population of Oshawa has been around 150,000 for quite a while, but it sits right in the middle of Durham region. If you've driven through that area, it's basically like Whitby, Oshawa, Crampton, like back to back to back. There's almost no division between. So overall in Durham region, there's about 600,000 people that are kind of accessing the Lakeridge Health Network. Some of the activities there, we do have the pictures starting from the top left. That's the Block and Art Gallery, and Parkwood Estate on the top right. That is the mansion where the McLaughlin family lived. That's the guy that founded GM. Can't have a talk about Oshawa and not mention GM somewhere. You might recognize it. That was in a couple of movies that I know of. Happy Gilmore and X-Men. Was the mansion in X-Men there. And then go to the bottom left. There's a picture of the waterfront. So it does sit right on Lake Ontario. There is a little beach there, actually. I do play beach volleyball. There's enough sand to have 3 courts, but that's about all. There is a beach. And then some trails that run along some of the small rivers, and there's a waterfront trail as well. We do have our own arena there, so people have been mentioning the hockey this morning. So we have the Oshawa Generals. We also have an NBL team, Oshawa Power, which if you're interested, and I think they are struggling for attendance, so you're welcome to check it out. If you want to see the big league stuff, Toronto, again, it's a 45-minute drive, about the same amount of time to go train and watch the Leafs or Raptors lose, but my tolerance for that's only about once a year. Bowmanville, Carrington, population about 80,000. The hospital there is about 80 beds, and again, family doctor running there, so when you're with your Bowmanville preceptor, a lot of them would be doing the inpatient care and emerge and that kind of thing. So a different feel. So there definitely would be some good benefits to having time meet there in each community. And then these are some of the little highlights of activities that we can have in Bowmanville. I'll just show the pictures again. So there's an Apple Fest on the top right. There's actually 2 zoos in Bowmanville. There's in the Animal Cat World and Bowmanville Zoo. There still are elephants at Bowmanville Zoo. As far as I know the Toronto Zoo lost their elephants recently. And there's Mosport International Speedway, so you can watch races, or they do actually have track days that you can kind of take your own car out and go for a spin. I've done that a couple of times. A lot of fun bringing home. For family things, there's skiing, there's golf, conservation areas. I mentioned there's a couple of farms as well where they do the pick your own and kind of little family activities. If you have children, paint your own Easter baskets or go pick up the eggs in the field, that kind of thing. Bowmanville is also well known for cycling, bicycling, and north of Bowmanville, beautiful rolling hills, countryside, straight concession roads, and just many different routes you can go on there. Okay, so questions at the end. There's some contact information here, or you can pick it up from the website. It's just a little picture from my back parking lot at the clinic. There are just 2 signs that are pointing and saying, keep this area clear between the 2 arrows, but not much room there. But hopefully you'll find that good fit, even if it's not QBOL, you'll have a good fit with your family medicine training and enjoy the next couple of years. Okay, thanks.